insurance companies are not broken. The system is not broken. It's working exactly how they want the companies to work, which is to make a large profit. And it meant that even within my clinic, our physical therapists have had to no longer be in network with commercial insurances and have reverted back to self-pay. So a couple of comments like these came up where they're saying, well, you all must be super rich. If you're going self-pay, you must be making double what a normal therapist makes. Or one that kind of really hurt my heart, which was that I guess it's only for the wealthy or the uber rich. And we tried so hard to accept commercial insurances, going in network, figuring the ins and outs of that system, and we came out the other side a little less than 2 years later. It might have been 3, and it just was not feasible. So it was either go under completely, attempting to appease to kind of the masses and still not give good care because of what insurance required us to do, or the timing limits that they would put on, or the rates that they would negotiate. Or it was to allow our amazing physical therapists to treat the way that they are meant to treat patients, do what they recommend, and get people better faster. And it honestly came down to math. So, if a patient gets 30 minutes of PT, because that's what is kind of just the limit of the amount of time that we could see a patient with the financial amount that we got reimbursed. Let's say 10 minutes of that is kind of like getting them into the specific office and a little chit chat, tell me how your week, tell me how your symptoms were. They get maybe 15 to 20 minutes of hands-on treatment. That is nothing. And if you take that they have to do a home exercise program as well, so maybe 10 minutes of hands-on and then 5 to 10 minutes of training, that is nothing. It was not sustainable for our physical therapists to continue accepting commercial insurance. And whether you think that means that we just don't want to help people who are financially insecure, I'm sorry that that's how you feel, but that's what we needed to do to even be open as a business to support anybody. And it's a really sad day that as a private practice, we have to sit there and we have to say, let's make this a little less accessible for some people so that we can stay open for anybody. But that's the system. That's how it's meant to work. We absolutely have done pro bono cases, so it's not like if you came to us and told us your story, and we attempt to do that as best as we can. Obviously we can't do that for everybody, but it's something that is always on our mind. How do we get our patients the best care possible while also supporting our needs to support ourselves and our families, and also the need to support the business as a whole?